Tuberculosis, often referred to as TB, is a serious and potentially deadly infectious disease that has plagued humanity for centuries. It's a global health challenge that demands our attention and understanding. The culprit behind this disease is a bacterium known as Mycobacterium tuberculosis. These microscopic organisms, when they invade the body, can trigger a cascade of health problems. It mainly attacks the lungs, leading to what we call pulmonary TB. This is the most common form of the disease, and it can severely impair respiratory function. However, TB isn't limited to the lungs. It can also spread to other parts of the body, such as the kidneys, disrupting their vital functions. The spine can also be a target, leading to debilitating pain and potential neurological complications. In some cases, TB can even affect the brain, causing meningitis or other serious neurological disorders. When TB occurs outside the lungs, it's referred to as extrapulmonary TB, highlighting the disease's ability to impact various organs and systems. TB has haunted humanity for thousands of years, with evidence of its presence found in ancient mummies and historical medical texts. It's a disease with a long and devastating history, and despite advancements in medicine, TB still affects millions of people worldwide, particularly in developing countries, posing a significant global health burden. There are two key forms of TB that are important to understand. The first is latent TB, where the bacteria are present in the body but are dormant and non-contagious. The infected individual shows no symptoms and feels healthy. The second is active TB, where the bacteria are actively multiplying, causing symptoms to appear and making the disease contagious to others. Most people with latent TB never get sick because their immune system is strong enough to keep the bacteria under control. However, those with weakened immune systems, such as people with HIV, the elderly, or those undergoing certain medical treatments, are at a significantly higher risk of developing active disease, as their bodies are less able to fight off the infection. Identifying and treating latent TB is crucial in preventing the progression to active TB and reducing the spread of the disease. This proactive approach is essential to prevent future outbreaks and protect vulnerable populations. It's important to remember that TB is a bacterial infection, not a virus, meaning it requires a different approach to treatment. Therefore, it requires specific antibiotics that are designed to target and kill the Mycobacterium tuberculosis bacteria. The bacteria grow slowly, which presents a challenge in treatment. This slow growth rate makes treatment a long process, often requiring months of consistent medication. TB's persistence through history serves as a stark reminder of its resilience and adaptability. This highlights the ongoing need for increased awareness, robust prevention strategies, and complete adherence to treatment regimens. Without proper care and treatment, latent TB can progress to active TB, making the individual sick and contagious, thereby threatening not only the individual's health, but also the health and well-being of the entire community. Understanding TB as a resilient adversary, capable of persisting for years in a latent state and developing drug resistance, is the first and most important step in effectively fighting it, and ultimately eradicating this ancient foe. Effective control of TB depends heavily on early detection through screening and testing programs, and strict adherence to the prescribed treatment regimen, ensuring that the bacteria are completely eliminated from the body. Tuberculosis, or TB, is not a modern disease. Its roots are ancient, stretching back millennia. It's a persistent plague that has shadowed humanity for ages. Evidence of it has been found remarkably preserved in Egyptian mummies, offering a chilling glimpse into the health challenges of the ancient world. These mummies serve as silent witnesses to the long history of this disease. The oldest confirmed cases are over 4,000 years old, discovered through careful examination of skeletal remains and ancient tissues. This demonstrates just how deeply embedded TB has been in human history. Throughout history, TB has been known by many names. Most notably, it was often referred to as consumption or the White Plague, terms that reflect the devastating impact it had on individuals and communities. In eras past, before modern medicine, it was almost invariably a death sentence. The diagnosis carried with it a sense of hopelessness and despair. For centuries, its true cause remained shrouded in mystery, eluding the grasp of even the most astute medical minds. Doctors and scientists were baffled by its transmission and progression. It was often blamed on factors like bad air, thought to carry disease, or simply attributed to heredity, a predetermined fate passed down through families. That all changed dramatically in 1882, marking a pivotal moment in the fight against this ancient disease. It was in this year that Dr. Robert Koch, a pioneering microbiologist, made a groundbreaking discovery. He identified Mycobacterium tuberculosis as the definitive culprit behind the disease. This monumental breakthrough is now commemorated annually as World TB Day, a day to raise awareness and continue the fight against this global health threat. Before the advent of effective antibiotics, the primary method of treatment involved isolating patients in specialized facilities known as sanatoriums. These institutions prescribed regimens of rest and exposure to fresh air, believed to have therapeutic benefits in slowing the disease's progression. Sadly, despite these efforts, the vast majority of patients did not survive their illness, highlighting the desperate need for more effective treatments. The landscape of TB treatment was revolutionized with the discovery of streptomycin in 1943, followed by isoniazid in 1952. These breakthroughs finally made the possibility of a cure a tangible reality, offering hope to millions affected by the disease. As effective treatments became available, sanatoriums gradually closed their doors, marking the end of an era in TB care. A wave of optimism swept through the medical community and the public, fueled by the success of antibiotic treatments. However, this optimism was soon tempered by the emergence of drug-resistant strains of TB, posing a significant new challenge to treatment efforts. The rise of drug resistance served as a stark reminder that TB is a constantly evolving adversary, capable of adapting to overcome medical interventions. Today, the fight against TB continues with unwavering determination, driven by the need to develop new tools and strategies to combat this persistent threat. We face new challenges, including the spread of drug-resistant strains and the need for enhanced surveillance and monitoring efforts. Constant vigilance is paramount. The story of TB is a testament to the power of scientific progress, showcasing the remarkable advancements made in understanding and treating this disease. Yet, it is also a story of ongoing struggle, highlighting the persistent challenges that remain in eradicating this global health threat. Over the years, our understanding of TB has grown exponentially, fueled by relentless research and innovation. Despite the progress made, the battle against TB is far from over, requiring continued dedication and investment in research and prevention efforts. TB's long and complex history serves as a crucial warning, reminding us of the ever-present threat posed by infectious diseases. We must never underestimate the adaptability and resilience of this ancient foe, and we must remain committed to the fight until TB is finally defeated. TB spreads through the air when someone with active pulmonary TB coughs, sneezes, or even talks. The bacteria are carried in tiny droplets that can linger in the air for hours. Inhaling these droplets is how infection occurs. Touching or sharing objects doesn't spread TB. Not everyone exposed gets infected. Risk depends on exposure time, proximity, and ventilation. Crowded, poorly ventilated spaces increase the danger. Most healthy people's immune systems contain the bacteria, resulting in latent TB. If the immune system fails, active TB develops, sometimes years after exposure. Quick identification and treatment of active cases are key to stopping the spread. Good ventilation in public spaces can dramatically reduce transmission. Simple actions like opening windows help protect communities. Active TB, or tuberculosis, often starts subtly, with symptoms that can be easily mistaken for something less serious. This gradual onset is one of the reasons why diagnosis is often delayed. People may not realize they are infected until the disease has progressed. The main warning sign, and perhaps the most recognizable symptom, is a persistent cough lasting 3 weeks or more. It's important to differentiate this from a common cold or seasonal allergies. The cough may start dry, initially producing little to no mucus. Then over time, it may begin to produce phlegm, also known as sputum. And in some cases, the phlegm is sometimes streaked with blood, a serious red flag that requires immediate medical attention. This indicates potential damage to the lungs. Other symptoms that often accompany the cough include fatigue, a persistent feeling of tiredness and lack of energy. Also, unexplained weight loss, where you're losing weight without making any changes to your diet or exercise routine. Fever, often low-grade but persistent. And drenching night sweats, where you wake up with your clothes and bedding soaked in sweat, even if the room is cool. These symptoms can develop slowly, often over weeks or even months, making it easy to overlook the illness or attribute it to other causes until it's advanced and more difficult to treat. The classic triad, fever, night sweats, and weight loss, is a combination of symptoms should always raise suspicion for TB, prompting further investigation by a healthcare professional. TB outside the lungs, also known as extrapulmonary TB, causes symptoms based on the affected organ. For example, back pain if the infection is in the spine, blood in urine if the kidneys are affected, or headaches and confusion if the infection has spread to the brain. Any persistent unexplained symptoms, especially in individuals with risk factors for TB, especially with a chronic cough, warrant medical evaluation to rule out TB and other potential conditions. Early recognition and diagnosis are crucial because it saves lives and prevents further spread of the disease within the community. Don't ignore the warning signs, especially if you have been in contact with someone who has TB, or if you live in an area where TB is common. TB can mimic other illnesses, making it difficult to diagnose, so awareness and vigilance are crucial for early detection. Prompt action, including seeking medical advice and getting tested, is the best defense against TB. Anyone can get TB, but some are at much higher risk. The biggest risk factor is a weakened immune system, especially for people living with HIV. Chronic illnesses like diabetes, cancer, and kidney disease also increase vulnerability. Malnutrition and poverty make it harder for the body to fight infection. Young children and the elderly are especially susceptible to severe TB. Crowded, poorly ventilated places like prisons or shelters raise the risk of exposure. Smoking and heavy alcohol use further weaken defenses. TB often strikes the most marginalized communities. Recognizing these risks helps target prevention and care. Diagnosing TB starts with a doctor evaluating symptoms and risk factors. Screening tests include the tuberculin skin test and blood tests to detect infection. A positive result means TB exposure, but not whether it's active or latent. Chest X-rays help spot lung abnormalities typical of active TB. Definitive diagnosis requires finding the bacteria in a sputum sample. Lab tests include smear microscopy, culture, and rapid molecular tests. These tests can also check for drug resistance. Accurate diagnosis is essential for effective treatment. Early detection prevents further spread. Modern tools have made diagnosis faster and more reliable. TB treatment is effective but demands strict adherence for at least 6 months. Patients take a combination of antibiotics, usually isoniazid, rifampin, pyrazinamide, and ethambutol. The regimen has 2 phases, an intensive phase to quickly kill bacteria and a continuation phase to clear the rest. Stopping treatment early can lead to relapse and dangerous drug-resistant TB. Directly observed therapy, DOT, helps ensure every dose is taken, supporting patients and preventing resistance. DOT is a cornerstone of global TB control. Completing treatment is vital for cure and community safety. TB remains one of the world's deadliest infectious diseases. About a quarter of the global population carries latent TB. Each year, over 10 million people develop active TB, and 1.5 million die. The burden falls hardest on low- and middle-income countries. Drug-resistant TB is rising, making treatment longer and more complex. Only a third of those with multi-drug-resistant TB receive effective care. Despite setbacks, new diagnostics and treatments are saving lives. Renewed commitment is needed to end the TB epidemic. TB's impact extends beyond health. It devastates families and economies. The disease often strikes adults in their prime, deepening poverty and straining healthcare systems. 8 countries bear 2/3 of the global TB burden, facing immense challenges. Everyone can help learn the symptoms, reduce stigma, and encourage early diagnosis. Support organizations fighting TB and advocate for strong public health systems. Universal access to care is essential for ending TB. Public awareness and action are powerful tools. Together, we can defeat this ancient adversary.